Good evening, everyone. Welcome to this session on cracking critical care paper for NEET's 2024 examination, which is going to be held in March 29 and 30th,
Good evening, everyone.
2025.
Welcome to this session on.
I'm Dr. Midhun Mohan, faculty in emergency medicine and critical care from Dr. Tutorials. Now, the reason for this session is because of this notice, which all of you might be knowing, which was produced by NB in 11th October, which says that there is going to be a separate critical care medicine group for admission to DM and DRNB critical care medicine, of which the 150 questions will be from topics of critical care medicine itself. All right. So that brings us to the question, what is critical care medicine? Now, there is a lot of overlap between emergency medicine and critical care medicine. Both departments manage patients who are critically ill, but the difference is that emergency department has to manage not only just critically ill patients, it has to manage patients who come to the emergency department with any acute symptoms. So they have to pick from this lot these critically ill patients, evaluate them, make a differential diagnosis, resuscitate them, trying to stabilize these patients, and then admit these patients or hand over these patients to the critical care medicine department. Now, the critical care medicine department continues the further evaluation as well as the care. They will be trying to arrive at the definitive diagnosis, continue the resuscitation, and once the patient is stabilized, they have to continue the supportive care as well. All right. Till the patient is stable enough to be shifted to a ward or the room. All right. So that's the work of the emergency department as well as critical care medicine department. Both departments have to manage all kinds of emergencies, which include both medical emergencies as well as surgical emergencies. All right. And both departments have to be specialists in resuscitation as well. All right. So resuscitation involves a lot of procedures. Okay. These can be life-saving procedures, or these can be procedures as part of your supportive care, like tracheostomy and all. Okay. Now, supportive care is also very important while these patients are in the critical care department or in the ICUs. All right. And everything is done in these departments, like in any other specialty, based on evidence-based knowledge. All right. Most of the things are protocolized. So we follow a lot of guidelines. We have bundles like WAP bundles, central line bundles. Then there are a lot of scores from which you can get a lot of questions as well. Then there are a lot of trials in critical care medicine, which you need to be knowing about. So what are the emergencies? Okay, see, the chunk of questions are going to come from the emergencies, right? So you need to know about medical emergencies. So this can include everything. Okay, everything in medicine which can present as an emergency. All right. Now, when I say about emergencies, it's not just about the management of these emergencies. You need to know relevant anatomy, physiology, microbiology, pharmacology, as well as the pathology behind those critically ill conditions, critically ill patients, the diagnosis, as well as how the management should be. All right. Now, the surgical emergencies, these can include a lot of things, all right, like acute abdomen, then trauma is a major chunk that we see in the emergency department as well as in the ICUs. Then obstetric emergencies is something that is additional, all right. Then pediatric emergencies, this is something which we are still unsure whether we will get any questions from pediatrics, all right, because if you remember, till 2022, the pattern was different. And we know one of the feeder specialties for critical care medicine, DM or DRMA critical care medicine, is pediatrics. And we know 40% of the questions before 2022 came from these feeder specialties. All right. And there were questions on pediatric emergencies as well, like congenital adrenal hyperplasia, then Kawasaki disease and all. All right. So we are yet not so sure whether such questions will be asked for the upcoming paper. We will have to wait for the information bulletin. Okay. Now, the medical emergencies, you need to know everything from infectious diseases, neurological emergencies like status epilepticus, stroke, psychiatric emergencies like serotonin syndrome, then respiratory emergencies like ARDS, acute respiratory failure, oxygen therapy, ventilator management of these patients, cardiovascular emergencies like myocardial infarction, aortic syndromes, valvular emergencies, then GI emergencies like acute GI bleed, renal emergencies like AKI, endocrine emergencies like DKA, hematological and oncological emergencies, dermatological emergencies like anaphylaxis, Stevens-Johnson syndrome, rheumatological emergency, toxicology. Toxicology is something which is very important, all right, especially for emergency medicine as well as critical care. It's one of the differential diagnosis for most of the conditions, all right. Then environmental emergencies like heat stroke, hypothermia, all these things we need to be knowing about. I'm just charting out just a few of these things to give you an example of what kind of things you need to expect for your examination. Then surgical emergencies. Trauma is going to be a major part for the exam. All right. Now, trauma can be head injury, spine injury, abdominal thoracic trauma. Then burns, you can expect questions from burns, orthopedic emergencies like spine fractures, then pelvic fractures, open fractures, all those things could be asked. Then organ donation, how to diagnose brain death. All right. Then transplantation related questions like graft versus host disease, transplant rejection. Then acute abdominal conditions like cholecystitis, cholangitis, appendicitis, perforation, peritonitis. Then postoperative complications, surgical infections like necrotizing fasciitis, abdominal compartment syndrome, all these can be expected. Now, obstetrical emergencies, this is also something that we need to be knowing about. It can include knowing about physiological maternal adaptations, hypertensive disorders, amniotic fluid embolism, antepartum, postpartum hemorrhage, trauma in pregnancy, as well as management of cardiac arrest in pregnancy. These are the least number of things we need to be knowing about when managing obstetric emergencies in ICUs. Now, resuscitation is very important. You can expect a lot of questions from resuscitation, especially scenario-based questions. All right. So the resuscitation can include airway management, knowing about oxygenation as well as ventilation strategies. For example, in COPD patients, it's different from ARDS patients. Then fluid resuscitation, what kind of fluids, when should you activate massive transfusion, then which vasopressors should be used in shock, what's the role of ionotropes in cardiogenic shock. Then you need to know a lot of life-saving procedures, which we do as a part of resuscitation. All right. So the procedures can include anywhere from intubation, tracheostomy, cardioversion, pacing, pericardiocentesis, lumbar puncture, bronchoscopy. And of these, a lot of questions can be expected from point of care ultrasonography or POCUS as we call it. All right. Emergency department as well as ICUs use a lot of point of care ultrasonography. All right. It's a major tool for evaluation as well as diagnosis in these departments. So you need to know a lot about point of care ultrasonography as well. All right. Then supportive care is also a major factor. Unlike from emergency department, ICUs perform a lot of supportive care like sedation and pain management, ventilatory support, nutrition support. That's very important. You have to expect a lot of questions from this area. Then post-operative care, those kind of patients also come to the ICUs. All right. Unlike in the emergency department, the ICU department has to take care of or cater to these perioperative patients as well, who can have complications also. Okay. Now, like I said, everything is based on evidence. So you need to be updated on what are the guidelines which are followed in critical care, the recent updates which are up there, then trials in critical care, what are the bundles that we follow in critical care. Then we have a lot of scores that we use in the ICUs. All right. Now, we know these are the eligible specialties, and depending on which specialty you are from, you need to cater your preparation according to that. This is something very important. Okay. You need to have personalized preparation. All right. Because specialties like emergency medicine, they cover a lot of these aspects. I already mentioned there is a lot of overlapping area between emergency medicine and critical care because both these departments manage medical emergencies, surgical emergencies, including trauma, obstetric emergencies, as well as pediatrics. Emergency medicine, they deal with a lot of pediatrics as well. Okay, so they have a sort of an upper hand because they have a good base here compared to the other specialties. All right. Now, general medicine department, they have exposure to ICU, good amount of exposure to medical cases in the medical ICUs. All right. So what they are lacking and what they should be focusing is on surgical emergencies, obstetrical emergencies. All right. So these areas they have to be especially focusing on. Now, respiratory medicine, if you have done respiratory medicine, again, you are not majority of the hospitals, majority of the institutions, they don't have much of an exposure to other medical problems, other medical emergencies. Okay. So they might be really good at ventilator management and managing the respiratory emergencies, but the other medical emergencies, then surgical emergencies, obstetric emergencies, they need to focus in these areas. Now, anesthesia, see, if you are doing a residency in a hospital, anesthesia department has an ICU, then you will be getting exposure to all kinds of emergencies, like medical, surgical emergencies. All right. But in many of the hospitals, the anesthetic department, they don't run their own ICUs, or they might be taking care of only the surgical ICUs. So the exposure to the different types of medical emergencies might be lacking for these residents. Okay, so you need to focus in these areas. Now, pediatric PGs, um, I don't really don't think there are many of the pediatric PGs going for the DM or DRNB critical care because they have a separate path for pediatric critical care. All right, most of them might be going for that. Okay, in case somebody is going for the critical care medicine part, they need to learn a lot about adult medical as well as surgical emergencies. All right. Now, our plan is that we are going to make a separate critical care group with a question bank in the tutorials app. Now, we don't have much time, all right, to make specific videos only for critical care. So what we have done is that, see, the good thing that we have done is that, see, most of the, at least 80% of the content which we require for critical care group is already there in the medical group as well as the surgical group. Because all these faculties, I am one of the faculty of NEET in the medical group. So I know what's there in the medical group. All the faculty have covered the emergencies, medical emergencies in the NEET medical group. Similarly, all the faculty in the surgical group have covered all the surgical emergencies as well. So what we have done is we have selected or handpicked the important topics relevant for critical care group from these two groups. All right. And we have joined them and put them into the critical care group. But still, there are some topics which are left out, which are not included in the medical or surgical group. Those topics we are going to cover as online interactive sessions. All right. So this will be taken by me. Then other critical care faculty are there who have a lot of experience, who are heading the critical care departments at KIMS Hyderabad, KIMS Secunderabad, and like Dr. Pankaj is there, Dr. Pavan is there. They will be joining us soon, and they will be taking the topics which are not covered in the medical group as well as the surgical group. And these are, we are going to present them in the online interactive sessions. All right. So the plan is that we are going to have at least one topic presentation, one session, one such interactive session every week. Within 3 or 4 months' time, I think we will be able to cover almost all the topics which are relevant for the critical care examination. All right. Now, in addition to that, we are going to conduct topic-wise tests. All right. So we are going to conduct at least 8 tests where all these topics have been divided into eight areas, and we are going to have these tests every alternate week. All right. Now, apart from these topic-based tests and discussions, we are going to have 2 grand tests and followed by the discussions. All right. This is mainly for practicing your time management as well as covering the entire thing. All right. When put together the entire thing, we are going to have two grad tests. Now, in addition to that, we will be available all the time. We will be having healthy discussions on WhatsApp group as well. So this is our plan, and you can get access to this critical care group through the Doc Tutorials app as well. We will be rolling out the app pretty soon. We have almost collected about 60% of the lectures in it, and we'll be rolling out by around mostly within the next 1 week. Okay. And we'll be starting the online interactive sessions also in the upcoming week. Dr. Pankaj will be taking the first session is on ventilator associated pneumonia. There isn't a separate session on this in the medical group. So we have included this in the online interactive session because it's a very interactive, very relevant and high yielding topic. Okay, so those kind of high yield topics we'll be taking in online interactive sessions. Okay, and after that, we are going to have, so this first session is going to be on November 6th or 7th. We'll be announcing that soon. Then he's going to again take the nutrition in ICU. Okay, enteral nutrition as well as parenteral nutrition. This is also a very important topic from which you can expect a few questions from it. All right. And it's a relatively dry topic if you're going to read through the materials. Okay, so it's very, so these kind of topics which are difficult to understand by reading any kind of books, we are going to take them as online interactive sessions. Okay, I think most probably he'll be taking it that topic on this 10th of November. And on the 14th of November, I'll be taking about point of care ultrasonography. That's also very important. You have to expect at least a few questions, 3 or 4 questions from that area also. Okay, at least you are going to get that point of care ultrasound information along with the other case scenarios. Okay, so you need to know what you are seeing there. Okay, now alternate. So those are the interactive sessions which we are going to plan. We are going to have one topic every week. Okay, all right. So I'm ready to take up any questions, any doubts if you have. The live chat is open in YouTube. You can post any queries there. Okay, we have a comment, I think. So many questions came from CT and MRI picture. It's possible. All right, you need to know the basic things about the CT as well as MRI findings in these various pathologies, especially the neurological part. Okay, we'll be covering those things. Okay, there's a question on topic on recent advances. Recent advances in critical care, you need to know a lot about the newer modes on mechanical ventilation. Even though none of these have shown to have any advantage over the conventional modes, this might be an area of interest for critical care people. All right. They might ask questions from newer modes on mechanical ventilation. Then the recent advances in ARDS. All right. Then sepsis management, then septic shock management, for example, methylene blue, use of methylene blue as a vasoconstrictor agent, as a vasopressor agent in a septic shock. Those are some of the areas. All right. See, it's a very broad question. Very lot of things can be asked, and we are trying to include that as a separate portion. The recent trials which are coming out, then the scores, we are going to put them as a separate portion in the app itself. All right, in the critical care group, in the doc tutorials app. If there are no further questions, I think we'll wind up the session. Okay. You can always reach out to me in my WhatsApp group. My WhatsApp number is 9567522186. Okay, I will repeat that, 9567522186. All right. So, good night, everyone. Thank you so much.